Hi, welcome to Live Healthy Miami Gardens Live. I am going to be your host for today. My name is Melissa P. Dunn. I am the CEO of MD Marketing Network. I am also a member of the Live Healthy Miami Gardens Communications Subcouncil. As you know, on Tuesdays around this time, we come live into your home or office or wherever you're watching this show from, and we talk to you about a health topic, something that's going to hopefully inspire you to take action to improve your health and the health of your family. So today's topic is all about hypertension. Now, hypertension is something that is a chronic disease that can lead to a lot of other complications. And I'm going to ask our expert today to come and kind of answer some questions. And I'm going to invite you to join the conversation. If you have a question or a comment, please type it in the chat. We'll put it on the screen and we'll get a response from today's expert live. So help me in welcoming Dr. Jacques. He is a nurse practitioner from CFCE. Dr. Jacques.
Hi, Melissa. It's a pleasure to be here. And today we'll be talking about an important topic, which is hypertension.
Yeah, this is such a important topic for many, many reasons, Dr. Jacques. But just for those who may not be familiar with the disease, can you tell us what's hypertension?
All right, Melissa. Hypertension, to first understand what is hypertension, we need to know all the blood pressure system work. So your tissues and body and all the organs, they need oxygenated blood. And the heart needs a force to send the blood to the blood vessels. So when this pressure remains elevated, when this pressure remains high in the body, that's when you're gonna start talking about high blood pressure. And it's also known as the silent killer because sometimes you don't have any silent symptom at all. So that's why it's important to start talking and to educate people about high blood pressure.
Yeah, that's so important. But you know what? Just so that we can lay the foundation about you really being an expert on this topic, Dr. Jacques, tell us a little bit about your clinical background.
Well, I've been a nurse practitioner for over 4 years, and I'm a doctor in nursing practice. But before that, I was a nurse for over 10 years with experience in medical, surgical, and all type of clinical settings. And right now, I'm working at CFCE as a primary care nurse practitioner. So I've seen a lot of people with high blood pressure. I receive like children and adults with high blood pressure, so it's an
Wow.
important disease. So we can educate people regarding the high blood pressure. It's really important.
You know, I never thought about children having hypertension, but you see that too, huh?
Yes, we do see that. We definitely see young adults, it's children with high blood pressure, and it's important to manage because you don't want them to keep growing with high blood pressure without being properly managed. So it's really important to do that. And at CFCE, we take this carefully. So we once we see that, it's important for us to manage it properly.
Yeah, I can imagine. I mean, having hypertension for anyone, right? Whether you're a senior or an adult, could
Hmm.
be really, like you said, it's a silent killer. But I can just imagine a child with hypertension, how complicated that could be. Who's at risk for hypertension, Dr. Jacques?
Yes, Melissa, we have to say that hypertension can be primary and also secondary. So
Hmm.
the people who are mostly at risk are, for instance, people with a family predisposition of high blood pressure. So if your mother, your father had high blood pressure, so you may be prone to have high blood pressure later in life. And also, some people develop high blood pressure due to obesity. Some people develop high blood pressure due to smoking, and also people who eat unhealthy can also develop high blood
Mm.
pressure. So some
Wow.
people with other diseases can develop high blood pressure later in life as well. So it's not only one risk factor; it's a combination of risk factor that
It's a
can lead
combination.
that can lead to high
Wow.
blood pressure.
And you know what? Out of all of those that you listed, there are a couple of them that sounds like things that we can control, right? We can control our diet. We can control whether we choose to smoke or not. We can control how physically active we are. We can control being
Definitely.
obese or not being obese. The only thing that we really can't control is our family history,
History.
right?
You're
But
correct.
if we control the other factors, will that help in
That
lowering the risk?
that help. That definitely will help. For instance, we have people who are obese, and once they start cutting off the weight, they can better manage their blood pressure. So some people will smoke as well. When they stop smoking, they can better manage their blood pressure. So it's like you mentioned, we have modifiable risk factors that we can work on. And once we start working on those modifiable risk factors, we can better manage high blood pressure.
Yeah, I get that. And
Mhm.
I can tell you that for me in my family, my personal history, on both sides of my family, my mom and my dad's side, there's high blood pressure and then there's diabetes, which I have type 2 diabetes.
Okay.
Knock on wood, I have avoided the hypertension, but it can be really scary
Exactly.
if
Exactly.
it's not treated, right?
If it's not treated, it can lead to several complication if it's not treated. So that's why it's important to stay on top of that. Mhm.
Yeah. How is it diagnosed?
So the way you should know about you should diagnose high blood pressure is to have it measured. So you need to know your numbers, Melissa. That's why we,
Okay.
we, we tell everyone you need to know your numbers. You need to know your risk factors. If, for instance, like you mentioned it, your father and mother had primary hypertension, so you need to know that you're at risk of developing high blood pressure later in life. So once you
Mm-hmm.
know the risk, and you know the numbers. For instance, you can have a blood pressure machine at home and you control your blood pressure. So you need to follow up with your clinician. So to diagnose high blood pressure, you need to have your clinician measure your blood pressure in several visits. So that's when you will
Okay.
basically know if you have high blood pressure or not. Some people come to the clinic and they have a high reading, uh, but they develop some what we call white coat hypertension. It may be because of stress or it may be because of anxiety, and the blood pressure is elevated during
In
the
that
in that
moment, right?
moment. So when
Mm-hmm.
they go home, the blood pressure may return back to normal. So it needs several visits at the clinic to basically know your from your baseline and to diagnose with high blood pressure.
Okay, got it. So remember I told you that my dad and my stepfather both have hypertension, right?
Mhm.
So I have been with both of them before where we're checking their blood pressure. And I know that there are two numbers that you look at. Can you help us
Exactly.
to understand those numbers and what do they mean? Like
Yes.
what is that?
Definitely, Melissa. The two numbers, one is called systolic blood pressure, and the other one is called diastolic pressure. So the top number is the systolic, like you mentioned. The
Mm-hmm.
systolic pressure is the pressure that the heart exert on the blood vessel when it pushes the blood. The diastolic blood pressure is mainly when the heart is resting between beats. So
Ah.
it's like one is between when the heart is pumping the blood, the other one is when the heart is at rest. So those numbers are important too, because sometime when they get too high, that's when some people start feeling like having chest pain, difficulty breathing. So it's important to understand the numbers. Like we said before, know your numbers. It's important to understand them.
Is there a range that's normal versus high? Like what's the range? What should we be looking for?
So normally, we tend to have say normal blood pressure is with a systolic less than 120, and with a diastolic less than 80. So once you start seeing more elevation in the blood pressure, like higher than 120 to 130, it's elevated. So we need to keep an eye on that. When you start having your diastolic pressure within 80 to 90, we need to keep an eye on that, because sometimes
Mm.
blood pressure progresses really slowly, and before you know it, it's already too late, it's already too high. So the number we
Wow.
should look for is that a systolic less than 120 and a diastolic less than 80. That's the normal.
Listen, Dr. Jacques, you explained that so well for the first time, I really fully understand how it works. That was such a good explanation. Like the systolic being when the heart is pumping, and that should be less than 120. And then
120.
the other one is when the bottom number is when the heart is resting, and that should be less than
Than
80.
80. Yes, definitely,
Yeah,
Melissa. And we need the
great, great,
the
great
community
way
to
to
know
yeah, that was that was a great way to explain it. Thank you for that.
that.
Thank you so much for that. So, okay, so remember I told you a while ago that my stepfather has high blood pressure, right? So
Mm-hmm.
when I was home for the holidays, we were together. It's like maybe the day after Christmas,
Mm-hmm.
because that morning we had just opened the Christmas presents, right?
Okay.
So we're in the family room, and I'm working, and he comes in, and then I see like he's unstable on his feet.
Okay.
So I get him and I put him to sit in the chair, and then he starts to slur his words.
Mm-hmm.
So being around, health communication as much as I do, I recognized immediately that he was having a stroke.
Okay.
And we took him to the hospital, and it turned out that he was having a stroke. He had like maybe 65 or 70% blockage in his neck.
Mm-hmm.
And the doctors attribute all of that to high blood pressure.
Yes, definitely that can happen. So, Melissa, definitely when we have hypertension emergency, sometime we have people with high number of blood pressure. Um, there's this is one of the complication of high blood pressure. You can have a stroke because once the pressure is too high, it start increasing the pressure on the blood vessels, and the blood vessels will support it. The blood pressure vessels cannot support all that pressure, and that's when they may burst, or some people will have what we call plaques in the future. So
Mm-hmm.
when they have plaques in the blood in the arteries, so that will increase even more the blood pressure and can put them at risk for a stroke. So you did a very good thing by going calling 911 and going to the emergency, because once you see that the person has like slurred speech, and you can recognize the sign and symptom of a stroke, it's a 911 thing. Call
Yeah.
immediately and go to the nearest emergency, because
Yeah.
once you start having really high blood pressure, like the 180s, 100 or 120s with the bottom number, it's an emergency. And always teach the people the sign and symptom of stroke. It's important to know that as well. The community needs to know that.
What are the signs and symptoms, Dr. Jacques?
Yes, sometimes you see, like you, sorry, you have a slurred speech, and the some people they passed out, and some people they have like a facial droop. You
Yeah.
see it in the face, and some people with once you see the speech is abnormal, the facial droop is abnormal, and they cannot stand. It's
Mm-hmm.
a 911. It's a 911 thing, and it's also important to mention, Melissa, timing is important.
Everything.
Every second matters. Once you notice that someone is having a stroke, it's a call 911 immediately, because time is a really important factor when someone is having a stroke.
Yeah, I actually have two family members who have a stroke. So my stepdad had it, and then his cousin had a stroke too. But
Mm-hmm.
his stroke affected his brain, and he, like, for months, he's just now learning how to stand again.
Okay.
It is, and when you watch somebody that you love, my stepdad is in the military.
Okay.
He's a retired military man that continued working for the Department of Defense even after he retired. So when you see somebody that's usually, strong and healthy, and they're having to relearn how to pick up a pen,
Mm-hmm.
it's heartbreaking.
Exactly. Exactly.
And based on what you're saying now, that if we know our numbers and are really mindful about our health, particularly when it comes to high blood pressure, that may be something we can prevent. Yeah.
Exactly. We can do that. We can do that basically. So if we know the numbers, like we mentioned before, the normal in systolic lower than 120 and diastolic lower than 80. Once we start getting higher, so you need to contact your clinician and discuss that with your provider at either your annual visit or or during a follow-up, because some people don't really pay attention to the numbers, but it's
Hmm.
really important because you may be stressed, you may have other risk factors. So, and when you go to a doctor, you may find out your blood pressure is already going to the roof, and with complication as well, because some
Yeah.
complication will arrive later on, and you won't even notice anything.
But let me ask you this: like people, like I've never really checked my blood pressure, like just to check it.
Okay.
So how can I? Because something has to happen to like to trigger you to check it or to trigger you to have a conversation with your doctor.
Hmm.
So as a layperson, like how? What are the symptoms that I should be paying attention to that will then trigger me to say, okay, let me go to the doctor and have this conversation?
Okay, so Melissa, sometimes you won't have any symptom at all. Like we mentioned, as the blood pressure as a silent killer, sometimes there's no silent symptom. But some people will start having like headache. They will start having pain in the back of their head or the neck. They will start having a problem with their vision. Some people will
Mm.
have chest pain. Some people
Oh
will have,
wow.
exactly, yes. Some people will have dizziness. So, but do not let that you start having symptoms to have the conversation with your doctor. Always know
Yeah.
your risk factors, and when you go to your annual visit, your annual well check, always discuss the numbers with your doctor. What I always suggest to Melissa is that you can have a log or document your blood pressure like in a notebook. If you know you have some risk factors for high blood pressure, get a blood pressure machine. You can get one, and you can randomly check your blood pressure early in the morning or at any time, and keep checking your number. Keep a log at home with your numbers. And when you go to your doctor, discuss that with your doctor. Do not you have to take control of your health.
Yeah,
Yes,
that's it. That's the bottom line, Dr.
it's
Jacques.
important.
Yeah. And that's part of the reason why we do the Take Your Loved One to the Doctor campaign, because we want to continue to educate people and to inspire them to go to the doctor. Like
Hmm.
every single year, we should all be having an annual visit. If
Exactly.
you're a woman, you should be seeing your GYN.
Exactly.
If you're a man, depending on your
Eh,
age, then you should be getting certain cancer screenings. And so it really all goes back to what you've been saying, knowing your numbers.
exactly. It's important, Melissa.
So is there a way for you to treat hypertension?
Yes. eh, to approach hypertension, Melissa, it's more than it's different type of approach. I mean, so you have to consider a pharmacological approach and a non-pharmacological approach, because what happens is that some people can not all people need medication to treat their blood pressure. Some people may need only lifestyle modification, for instance, smoking
Mm-hmm.
cessation. Some people need to limit their alcohol. Some people need to lose weight. Some people need to eat better, like less salt, less greasy food, less fat. And but other people may need to be on medication. So when we receive them in the clinic, we we check their previous blood pressure medication with their previous blood pressure reading and the current blood pressure reading, and we determine if they need any to be put on any medication. So other than blood pressure medication, we need to put them on lifestyle. We need to encourage lifestyle modification as well. We need to encourage everything that can help, because it's not only one factor, one approach that's gonna help, that's gonna work. It's a
Mm-hmm.
combination of intervention, medication with lifestyle modification. So we can treat high blood pressure, but the patient needs um, to do other stuff as well, like to cut in the drinking, to stop smoking, to lose weight. So it's a combination of intervention.
Okay, so I love that. So, the doctor has a part of it's a teamwork thing,
It's a
right?
teamwork,
So
exactly. It's a teamwork.
so
So
you guys will give you'll give the medication, and then the person at home have to comply with the medication,
comply with the
but they
medication.
also get to change the way that Man, I can
Yes,
tell you that is so challenging.
it is.
Like, what
It's
do you have any tips to make it easier for folks to like changing your diet and your and exercising? It can be a challenge. Like,
so
what tips do you tell your patients to
so
get them to comply?
it's not easy at all, Melissa. I have to admit that because facing health challenges, it can be complicated. Um,
Mm-hmm.
but one thing is that we were talking about taking control of your health. That's one we need to start with that. Take control of your health. It's not too late to take control of your health. So once you admit that you need to change, um, your provider will work with you with all the steps that you need to take. For instance,
Okay.
we can start slow. Um, we can start with 20 to 30 minutes of exercise every day, or you can start with if you used to drink like 4, 5, 10 beers, you can cut down in one beer. If you used to eat a lot of salt, you can start reducing the amount of salt you have in your food. So it's not easy. We understand that, but it's a progressive approach. It's something that
Mm,
you can do progressively with the help of your provider. So, but it's important. Your life or every patient life is more important than the bad habit. That's what I always say. Sometimes it's not easy to change habit. You have to replace it with something else. But your health is the priority. Once you diagnose with high blood pressure and you're on medication, it's gonna be difficult to be taken off the medication because you have to keep it under control. So you need to take control of your life. Start doing what you can. Start addressing the modifiable risk factors. So
yeah.
that's why it is important to know about your risk factors and to know what can be done so you can take control of your life, of your health.
Man, I love the way that you say that. Take control of your life because it does come down to that, right? It comes
Yes,
down to
yes,
personal responsibility.
yes, Melissa. It's important because high blood pressure can have so many complications, and young adults, and actually they're really suffering with high blood pressure and so many complications later in life. So if they can take control of their health right now, some of the complication can be prevented.
Yeah.
We really encouraging prevention, health promotion and prevention. It's better to prevent complication than to deal with it later. So it's important.
Yeah. And you, sometimes even for myself, right? Because when, having watched my grandmother suffer with diabetes and having her foot amputated, and then, having watched my dad suffer with heart disease and diabetes, and now watching my stepdad go through a stroke,
Hmm.
there's a part of me that's like, oh my gosh, I am going to be 50 this year. And maybe I have like another 20 years to live, God willing, right?
Yes.
But it's really not too late for me to make changes now. It's not too late for me to, well, I mean, I've already cut out the red meat and all of that, but it's
Mhm.
not too late. Even if you're in your 60s or 70s, you could still make changes, right?
Exactly. You can definitely. It's not too late. It's not too late. Melissa, we have people in the 70s, 60s, and they're doing amazing. Not only with medication, but they take control of their health with all the modification that need to be done. Some of them it's by healthy eating healthy. So
Mhm.
they eat more fruit and more vegetables. They're reducing the amount of salt. They eat less canned food, less processed food, and they're seeing their numbers going down. And it's not only like with the medication. It's not like magic, but they work
Mhm.
toward that. It's like they have a goal and they work toward the goal. It's not magic. You can work toward it. It's not easy. Some people have resistant high blood pressure. We understand that, but
Mhm.
what can be done in your part is to work on the modifiable risk factors, not taking too much salt. If you, for instance, if you have resistant high blood pressure and is still eating a lot of salt, the blood pressure will go even to the roof, even more higher and higher. So
Hmm.
it's important to work on that. We always encourage people to do that.
You know what? You actually just brought up a good point. Are there foods that could trigger high blood pressure?
Sure. We have some food that basically can trigger high blood pressure and can contribute to someone having high reading of blood pressure. For instance, people who consume food high in salt. That's a no-no. You cannot do that. And people, some canned food like some processed food, processed meat as well. They're really high in salt and also in trans fat. So we discourage people to consume those food, and mostly when they are at risk of developing high blood pressure. So we encourage people to eat more vegetables, whole grain, fruits, and drink plenty of water instead of consuming too much of those. So you got your water here. That's good.
I have
Mm,
put a bit of pineapple
you put some
in the
pineapple.
bag to make it easier for me to
That's
swallow,
good. You can put
easier
some
for me to
you can put some cucumber, some pineapple in there, and that will help definitely.
drink.
That will give good flavor to your water, and
It
that
does. It does. But Dr. Jacques, listen, I'm Caribbean, okay?
okay.
And so the thought of eating like certain foods and having no seasoning on it, like
Mhm.
seriously, who does that?
It's difficult, Melissa. I'm from the Caribbean as well, and we know the value of a little bit of salt. Want to taste the food, the good the salt in the food. So we
Mm-hmm.
know that, but culturally that's us, but remember that our health matters a lot. So
Mm,
the cultural approach the cultural approach is that start reducing a little bit of it, start
yeah.
progressively. We can do it
Small
progressive.
digestible changes.
Exactly, small adjustable changes. We can do that. So it's difficult once when you grow up with like a tradition and to change it abruptly. We know that, but you can do small changes at a time. One day at a time. So it's not easy.
Yeah. Well, and it sounds like having some support would be helpful too, because I know at CFCE you guys have a nutritionist, right?
Yes, that's a good point, Melissa. We have at CFC, we have a nutritionist there. She's helping a lot of patients actually. She help people with obesity, and she also help people who are struggling with food choices, or for instance, people who cannot who are struggling to eat well healthy. So the nutritionist, what she does, like when we refer you to her, she takes some time to speak with you and also educate you about healthy choices, educate you about what you can eat, what you cannot eat, and what you shouldn't eat, and the impact of certain foods on your health. So we have this at the clinic, so people we can refer some people to the diet to our nutritionist here, so she will be really helpful in
Oh,
making those
fantastic.
adjustable changes. Exactly.
Fantastic. We'll put the contact information for CFCE at the bottom of the screen if anyone would like to reach out to book an appointment with Dr. Jacques or anyone at CFCE. Certainly, you can also go at livehealthymiamigardens.com, which is your trusted source for health information. And there you'll find a link to CFCE and other low cost providers
Mhm.
in the city of Miami Garden. So, we talked about hypertension and the risk factors and kind of, the importance of taking control of your life, taking control of your health. And we've shared that there are resources available to help people to do that. Any final words of wisdom, Dr. Jacques?
So, Melissa, what we want to tell, what we want to say to anyone who's listening, it's not too late to change. Your health is a priority. We promote um, we promote healthy changes, healthy lifestyle changes. So it's not easy to do, but you can make it. So take control of your life, take control of your health. It's not too late. High blood pressure has a lot of complication that it can cause, but do not let like that it's too late for the complication to arrive to occur. Take control of your health now and
Yeah,
manage
and
yourself.
such great advice, Dr. Jacques. Thank you so much for joining us today for this powerful conversation. And I could tell you, my family, we're currently dealing with one of the unfortunate consequence of having high blood pressure and hypertension, and it's not easy. It's quite painful, and so I'm all for it. And I'm thinking about myself too. I'm like, okay, drink more water, manage the weight, cut down on the salt,
Result.
maybe use more natural seasonings, and just control what we can
More
control.
fruit and vegetables. That's exactly, yes, exactly.
Well, thank you so much for this conversation. I now am clear that the top number needs to be less than 120, and the
20,
bottom number needs to be less
less
than
than
80.
80.
Anything different, immediately have a conversation with your doctor.
Get a conversation with your doctor. Generally, the blood pressure will change, but get the conversation with your doctor. Start talking to your doctor. They're here for you.
Wonderful.
Start talking to your doctor. Bring the numbers to the doctor, to your provider, so they will help you make the changes you need.
Great. Great conversation, Dr. Jacques. Thank you for joining us.
You're
And
welcome, Melissa. It's a pleasure to be here.
join us for another episode of Live Healthy Miami Gardens Live. As always, livehealthymiamigardens.com is your trusted source for health information. And we'll see you back here again next Tuesday at 3 p.m. with another health conversation. Be well, everyone.